When students come here, they become student professionals day one, and that's how they're treated, and that's what we expect out of them, is to perform as a professional while they're a student. That's how they learn, and that's how they become great practitioners.
On our first day of physical therapy school, one of the faculty members went up to the front of the class and said, "You are now our colleagues, and that's how we're going to treat you."
I didn't really want the classic 9 to 5, and I wanted something that would keep me on my toes and had basically a lot of different facets of the profession itself. And I think that's very evident in physical therapy, and it really embodies that.
The physical therapy program here, it's tough and it's rigorous, but it's so well worth it.
We've just recently changed the curriculum, so it's really designed around a structure where there's a lot of basic sciences that are integrated now early on with clinical studies as well.
I think there's three things as far as that make us unique at Creighton. The first is our approach to student-centered learning. The second is our faculty expertise, and the third is our commitment to service learning.
The faculty members are really there for you, and they want to create that bi-directional mode of communication. So it's not just, them giving you a wealth of information and then you just absorbing it, but they're also receptive to your needs, your desires, and what you want.
I think the interprofessional education is an extremely important one for students to know about, simply because that's where our healthcare system is going.
We have a unique common curriculum where the residents from PT and OT, and sometimes pharmacy, actually meet and all are involved in this common curriculum. That's unique for our program. We don't know of too many other programs that do that. Physical therapy is a practice where Creighton's mission and the Jesuit values fall right into caring for the person, cura personalis.
Just a big thing that I want in my life is service to carry out through my life, and I think that's really at the core of what physical therapy is, because you use your own expertise and the knowledge that you gain in the classroom to directly impact those around you.
We want our students to be able to have a penchant for that, because that's what they're going to be doing when they graduate and when they go into care. They're going to be providing service of one type or another.
The social justice aspect of it is that we're treating each individual patient as an individual and the whole spirit and the whole body. I think a lot of the other programs that I saw were not necessarily so intertwined with the individual. It was more like you're treating a knee or you're treating an ankle.
Our program is unique. It's very mission focused. So one of the things we talk to a lot of students about is the idea of doing service. And we have a program that's really full of service opportunities right from the start.
One of the opportunities that students at Creighton have during their final year of physical therapy school is to travel to the Dominican Republic through the Institute of Latin American Concern. Students are taking all of the skills that they've developed over the last 3 years of school and really putting them to service for a population that otherwise would not receive services.
There's a huge community here. You're in class with 60 plus PT students, and you guys have all the same classes together. So you build this huge community with each other where you rely on other students and faculty to help you with classes, and everybody helps everybody else out.
Knowing that all the students and the faculty here, they're all here and pulling for us. Everybody wants each other to succeed.
I'm really excited about my first clinical rotation. I just found out that the alumni network, I got like 6 emails this morning of alumni reaching out to me to offer me a place to stay for my first clinical rotation, which blew me away because I was not expecting that at all.
This Creighton network, I think, is something that is so important, and the students see this and they learn how to make those connections early, and it's so advantageous to them in terms of their professional life. If I was a patient who needed physical therapy care, I'd want a Creighton physical therapist to do it. And we feel very strongly about that. We teach our students in that way, and when our students graduate from our program, they're very skilled clinically. And so they become practice ready. And that's really important as they go out into the job market.